Welcome to Body by Poly. This is Heather McCue, a licensed bodywork therapist and the owner of SolaFlow Bodywork Therapy here in Santa Barbara. And you specialize in lymphatic drainage massage and myofascial release massage.
So I specialize in a few different modalities. The main ones being manual lymphatic drainage, myofascial release, and an assortment of nervous system focused energy work. So I have found that the combination of the three of those types of work create just a beautiful treatment that not only feels good, is deeply relaxing, but also super beneficial to our health and our system, especially post-operative care. A good analogy for it would be is receiving lymphatic care before surgery is like clearing leaves from a drain before a big storm, right? You want to make sure that your system is already in flow before it gets hit with this big trauma. So taking those steps to make sure that you're in as good of health as you can before the surgery leads to a way better recovery post-surgery. Our lymphatic system is a whole system of the body. So ensuring that everything is in proper flow, as well as the area that received the surgery, is best, depending on the type of surgery that they got, their recovery time, how many treatments I recommend, it differentiates.
Let's take an example, because I have so many examples of patients who just come in raving about what you do. But let's say I do one of my typical like mommy makeovers, a tummy tuck, let's say on a breast lift, and they're a week out from surgery.
A week out? So
Yeah.
typically I wait till they're cleared by you at that 2-week post-op care or check-in that you guys do. And then as soon as we can get the lymphatic drainage happening, the better, because clearing that acute inflammation right around all the surgical areas is just so important for the healing process. It makes sure that there's proper blood flow to the area, that all the building blocks of our new tissue are there, and helps with pain management as well, because that excessive swelling does cause extra pain. And in terms of the nervous system focused work, when we have a trauma to our body, we're in that sympathetic state, right? That fight or flight. Our body is not able to heal properly when we are when we're stressed. And so being able to get the clients into that parasympathetic, that rest and digest, is just ultimately so much more beneficial than really the lymphatic drainage itself is beneficial, but getting people into the state of healing is, I think, in my opinion, one of the most beneficial things.
Yeah, that's why I really love working so closely with you, because you're right. When somebody has surgery, it's a stressful event. It's like a trauma.
Yes.
And the body does go into that acute trauma response, stress response, and inflammatory response. So there's a lot of release of hormones like cortisol, growth hormones, cytokines, and all of those things create an inflammatory environment. And that's why people are often very fatigued after surgery. And it's not just because of the surgery, it's because of that response where the body is really pooling resources to heal the injury.
Exactly.
So of course I know what conceptual lymphatic drainage massage is, but how does a lymphatic drainage massage actually work? What magic do you do? Yeah.
Typically, I start with a full body scan. So
Mm-hmm.
I start at their feet. I get a really good idea of where they're holding stagnation within their body. I stimulate all the different lymph nodes located all over our body to make sure that there's no congestion within those. And then I move straight to their head. I do work like craniosacral and a few other types of nervous system focused modalities to then allow them to, in the beginning, sink into that parasympathetic state so that the rest of the treatment, they are in restorative, a state of restoration. And then I go section by section. I start at the head, move to the neck. You always want to open up the left side of the body first.
Interesting.
That way, because really within our lymphatic system, from the legs up and the left arm are all draining into one vein. And then it's really just the right arm and the upper half of our chest that's going into the other one. So you really want to make sure that this side is open first. And then we go, after both the arms are done, we move up the legs, pushing as much fluid as we can up. With lymphatic drainage, there's two different places within the body that the fluid does drain into. It either goes back into our circulatory system or into our kidneys to then
Be evacuated. Yeah.
be evacuated
Right.
as well. Yeah. So this also helps with blood flow, because what is getting put back into the circulatory system is blood plasma that was just stagnant within our body. So if our blood is not as fluid as it should be, it creates harder transportation of nutrients to the surgical area.
And is there anything specific that you do as far as the scars themselves? Because since I've had patients undergo these treatments, I do see their scarring and their healing improve and over time.
Absolutely. We do a few different things. So I highly utilize red light therapy. Right off the get-go, we start using that. That helps with the appearance of the coloration. Red light therapy also helps with mitochondrial reproduction. So more cells are being produced in the area that is healing. So that just leads to quicker healing, better coloration. And then as far as the manual part, I always address the acute inflammation. Acute inflammation is the swelling right around the surgical area. So that tends to be more than the rest of the body, although the whole body really does inflame after a trauma. So very lightly pushing that away, allowing for better blood flow to the area, is one of the most beneficial things you can do. And as we progress in treatments, I work directly on the scar itself, starting about week 3 or 4.
Right.
This really helps to stop any scar tissue formation in the first place. Instead of addressing it after the client has healed, we clear it away from the get-go.
Yeah, no, I agree with that 100%. Matter of fact, I always recommend to my patients either do a simple massage themselves on the scar to break up that early scar formation, and then do a lot of pressure therapy with silicone tape. So all of those things help.
Yeah.
Scars continue to evolve and mature even up to a year out from surgery.
Absolutely.
So how do you put together a plan for patients? Let's say it's specifically scar related, like an early plan and then moving on as the scar evolves.
In terms of the scar itself, I've had clients that have come to me that did not receive lymphatic drainage post-surgery, and their scars they're not happy with it. That's why they're coming to me. So in terms of scar recovery, I've seen incredible transformations for even scars that are about 12 years old.
Really?
So really there's hope for all scars. The sooner you can do it, the better. But it is scar tissue. So very simple, breaking that up over time, getting rid of the general inflammation around it helps with the appearance greatly.
Yeah. When I personally send patients to you, that you're seeing them early, even at 2 weeks, it's still relatively early in their recovery phase. And I think that's super important. But I'm always curious, how do they feel after they've had a session with you?
Oh, they are euphoric.
Yeah.
And you wouldn't expect a surgical massage to feel as good as it does. But lymphatic drainage is a very light pressure massage, especially around the area of surgery. And it's honestly just very calming, which is one of the biggest points of it, is to allow for that restorative time. After surgery, it can be a very emotional time for these clients. And I think having a professional come in, reassure them, be there to hold their hand in a way and let them know this looks great, or even bring, if something, not with any of your clients, of course, But if something is maybe a little bit off, having someone that they trust be there to make them aware of it.
Now, listen, as meticulous as you can be with any surgery, you can't always control the healing process. There's a lot of things that can happen that are out of our control.
Absolutely.
So that's why I think it's important to incorporate these modalities.
Yeah.
And how often would you recommend they get a lymphatic drainage massage? Starting when and how many sessions? What do you think is the best protocol?
Ideally, at least one before surgery.
Right.
And then after you've been cleared for that, after the 2 weeks, it depends on the case, right? Typically recommend between 4 and 6, spaced about a week apart.
Mm-hmm.
And that seems to do the trick for most recovery processes. Some are a little bit greater depending on your age, your health when you got the surgery. Everybody's different. I've seen people blow my mind with how quickly they've healed, where I see them twice and the next time I see them, I can't believe how quickly they're healing. And that's what we hope for.
Yeah.
So.
I mean, if following that protocol, that would put them at about 6 to 8 weeks after the surgery.
Yes.
Which is usually when I release people to go back to their full activities, like working out. And so combining that timing and doing all those modalities early, I think is key.
Yeah.
Yeah.
And I think I offer a lot of education as well. So there's other things that you can do as the client to reduce your inflammation within your body naturally. So adapting deep breathing exercises and mindfulness where you're calming your nervous system. Deep breathing stimulates a lot of our lymphatic system as well. And you're, especially depending on the surgery they got, engaging those core muscles is one of the best things you can do. That doesn't require a lot of physical activity, of course. Yeah.
Yeah. So it's not just a massage, is it? It seems like there's a lot of anxiety after surgery because there's an anticipation of pain. Am I going to be uncomfortable? There's an emotional component to it.
Absolutely. And I think that's one of my biggest roles that I play here is that emotional support and the understanding I have that they did just go through something traumatic to the body. Even if they don't realize how it can affect them emotionally, I can see that they're feeling it because they are in that sympathetic state. And seeing them transform from high stress, high anxiety to relaxed and their body's feeling better and less inflamed. And I can let them know it's looking good. And it's just the reassurance that I think most people are really looking for. And which is another reason I love doing before surgery so that I can start building that relationship with them. I know what their body looks like before. I know what's normal, what's not normal. And
yeah. So you have a long history and like a family history of this, right? How did you get into this? Tell me a little bit about that.
So not so much lymphatic drainage. That was my own personal path. But both of my parents were body workers. My dad is still a body worker. And I grew up going to massage studios, doctor's offices. My dad worked with a lot of osteopaths. Some of my earliest memories are of working on people. My mom tells a funny story that when I was 2, I was never heavy enough to put the pressure. And so I would just sit on top of them using all my body weight. And
that's so funny.
Yeah.
Because here's the thing. So every now and then my wife will say, hey, give me a massage, rub my shoulders. And I'm good for 4, maybe 5 minutes. And then I get cramped up. I can't. How do you do that all day long and still?
It's just part of my purpose. I think I was given the right muscle tissues to do this for a while. It's been almost 12 years that I've been doing it professionally, and switching to really mainly lymphatic work has helped as well because it is such a light tissue work. When I was doing 5 deep tissues a day, it wasn't necessarily the same situation. But yeah, the work that I do is intentionally not as hard on my body so that I can maintain my physical self and longevity as well.
You mentioned lymphatic drainage massage is mostly what we're talking about in postoperative care. But beyond the 6 to 8 weeks, do you then transition into a different kind of massage with these same patients?
Yes, I'd say probably 90% of the clients that you have sent me still continue to see
Right.
me afterwards because they have seen such a benefit of receiving this work. I also do something called myofascial release, which our fascia system is basically our energetic shield from the world. So releasing the energetic emotional trauma within our body that we've held since some before birth even is one of the most beautiful experiences, and it does take time to get to all those different layers. And so I do a introduction with it to the post-surgical clients, and then most of them, they don't want to leave me. I don't know.
I've only gotten tremendous positive feedback from my patients, and I'm going to continue to send them your way. I don't know, you're going to get too busy very soon. Heather, one of the things I wanted to ask you specifically, because it's a big part of my practice, is patients with breast implants, patients who've had breast implants for many years, present to my office with symptoms related to breast implant associated illness, also known as BIAI. These patients come in with sometimes years experiencing symptoms that are sometimes vague, but persistent. Symptoms like chronic fatigue, mental fog, irritability, anxiety, and sometimes even physical manifestations like skin rashes or issues like that. Of course, when they come to see me, we formulate a plan for implant removal, and that often takes care of the majority of those symptoms, but the symptoms sometimes persist. And I think it is related to an immune response to the foreign body, but an inflammatory response. And I've sent some of those patients your way. So what's been your experience with them?
Yeah, definitely that foreign object is causing the inflammation within their body. Inflammation does cause that chronic fatigue, that's just feeling sluggish, stagnant, feeling within your body. So after they get their implants out, it might not be right away that they start to feel recovery happen because their body is still holding on to the inflammation caused by that. So they are still feeling the effects of having those within their body. So the lymphatic drainage helps get rid of all that stagnant fluid that was created due to the implants themselves that is causing them to feel that way, that sluggish, even those physical symptoms. It's that irritation of the body just not agreeing with having those in there.
So when I do a breast implant removal or explantation, obviously that's centered around the chest, but you're talking about a full body reaction to the foreign body and inflammatory process. So do you modify the massage in any way, or that's pretty much the same approach?
I do full body with every single treatment. It is the system of our body in order to bring any system within our body back into a proper state. You have to address it in its wholeness. If I were to just address the specific area of inflammation, it would maybe for a day or two help it, but it would just become stagnant again because nowhere else in our body is flowing. We're still full of that stagnant fluid that could be there from up to 10, 15 years ago. It really depends on the person's health.
All right.
As well.
Along those lines, one other thing that my patients almost exclude, all of them have, because after surgery, there are a lot of things that disturb your gut flora. You get anesthesia, you're on pain medication, you're getting antibiotics, and that wreaks havoc with the intestinal flora. So constipation is one of the main issues that I have a lot. So what's been your experience with that?
Absolutely. Constipation is a huge thing that comes with that, with lymphatic drainage. So we are getting rid of all of those toxins within the body that is causing that. So step one is get rid of the thing that is causing that in the body. I also work directly on the colon itself. And so if there is buildup and blockage in that area, I can feel it and I I manually can help relieve that pressure. And again, it's very similar to getting a system back into flow. Our body forgets, right? It's so focused on healing other things
process, yeah.
and it's just not a priority to it. And so I come in and remind it, this is actually still a priority. I know you're doing a lot of work, but we do have to get rid of this as well. And I also teach clients to do that massage themselves. Doing a colon massage on yourself is quite simple. It's always starting at the right, going up, over, and down to the left. Really light pressure, just stimulation of that tract to get moving again.
What does the practice look like for you moving forward? Obviously, you're growing tremendously.
Yes. I definitely see myself bringing on another staff member, doing some training. I'm really dialing in what it is about my work, my essence, whatever it may be, that is keeping people so inclined to come back. I'm developing a training around that and having more staff, because I do think that there's such a need for lymphatic drainage within our society, even separate from post-operative care. It detoxes our system. We are so overloaded these days with toxins, everything we're putting on our skin, our body. Everyone can benefit from receiving lymphatic drainage. And it's, I think, one of the most critical things we can do when you're on any sort of a healing journey is to flush out that stagnant fluid, getting the fascia moving again. Lymphatic fluid moves through fascia. So really they go hand in hand, releasing that tight fascia and getting the lymphatic fluid back into flow. My overall goal with every client is essentially retraining their lymphatic system on how to properly flow, because in an ideal world, it's doing its job. Lymphatic fluid is supposed to move on its own through movement, through deep breaths, but with over time, that stagnation starts to add up. Our body kind of forgets what to do with that. Our body knows how to heal itself. Right. It just forgets. And so my job is to come in, teach it again. Hey, remember we're supposed to move all this? And it feels really nice to clear all that out. And I've seen just the most incredible results with clients that were really dealing with chronic fatigue, anxiety, a lot of emotional stuff, swelling all over their body, make incredible transformations that I'm so proud of.
No, that's amazing, because you mentioned a lot of things there, that swelling is associated with so many things that aren't post-surgical.
Yeah.
A lot of people just overall health and wellness, they have issues with swelling in lower extremities. Of course, the kind of surgery that I do, it comes with swelling, but there's other surgeries like reconstructive surgeries, patients with breast cancer who've had a lot of issues with. Have you ever had to deal with some of those patients?
Yeah, absolutely. Yeah. I have quite a few clients that come to me with these kind of chronic illnesses, really looking for just support within feeling better in their body. And yeah, all sorts of clients come to me. And I think really it's the combination of the lymphatic, the myofascial, and the nervous system focused treatment. It's like the perfect triad for anybody dealing with any kind of discomfort within themselves.
Well, again, going back to what I do, the surgery obviously is a big component of it, the transformative aspect of that. But if you don't add the patient component and the post-operative recovery component, you just don't get the same kind of outcomes.
Absolutely.
And I've advocated for that forever in my career, because I've found it's so beneficial to have patients, because the recovery is where it happens.
Yeah.
And if patients don't follow the instructions the way they should, or if they don't get the proper post-operative support, the outcomes could be so dramatically different.
Yeah. Yeah. And I think it is important to have a plan in place before the surgery, and knowing that you have that support coming in for you can help with the initial anxiety, and maybe even getting a nurse to come with you, stay with you, and help you for a week or so after, finding a physical therapist that can help you rebuild that muscle, as well as adding in the lymphatic drainage. There's plenty of things that you can do to really help support yourself emotionally and physically post-surgery.
Oh, yeah. I think you hit the nail on the head there, because that's why I've developed a close collaboration with you, because as far as I'm concerned, it takes a team to really get that great outcome. So obviously I'm doing the surgery, but I'm creating that stressful environment. And then it's important to have the patient have post-operative support for pain management, which we do a lot on that end. Having the nursing support so that they feel comfortable, that they don't stress out too much about issues that can happen post-operatively. And then finally, getting in your hands where they have that lymphatic drainage massage and emotional support.
Yeah, exactly. Yeah, it makes such a difference physically and emotionally. I've seen clients just completely do a 180 in just one treatment. They just need that somebody there by their side, and they know that they are cared for and they've got some eyes on them and everything looks good. So
Plus, they just feel calm when they see you.
I actually just show up. So
I just shine. I just show up and then they feel
I just
better.
show up and they're better.
No, listen, I've had a massage from you, so I know exactly what you do. And trust me, you know what you're doing.
Thank you.
Yeah. So what does the future hold? What's next?
Oh, who knows? It's ever evolving day by day. I am very intentional about how I can help more people than just one session at a time. I think I'm developing a really good system of a treatment. So the combination, like I said, the fascia, lymphatic, and nervous system, in my opinion, is one of the most beneficial things that we can do for our body. I think, I'm not sure. I'm just taking it day by day in the evolution of my practice, and I'm very intentional within each treatment. So taking time outside of treatments, I think, will be important for me. Kind of develop the future a little bit, but hopefully something big, and we can help a lot of people heal.
You're already helping a ton of people. I really appreciate it, because I see the results of what you do every day. My patients come in and they're so thrilled to have somebody who had a complete makeover just 2 weeks later, just walking up almost upright, with minimal inflammation, minimal swelling, and minimal bruising. So I think those are all such benefits that I wouldn't do it without you.
Oh, thank you.
So thank you very much for
honored
taking
to
the
work
time.
with you.
And let's see what the future holds. Thank you. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.